What methods did optometrists use to find astigmatism? Imagine trying to see clearly through a window that's slightly warped or uneven. That's what astigmatism feels like, and optometrists have a variety of precise tools to detect it. First, they often start with a refraction test. In a manual refraction, the patient looks at an eye chart while the optometrist switches different lenses in front of the eyes using a device called a phoropter. The patient is asked which lenses make the letters clearer. This subjective test helps determine the degree of astigmatism by finding the lens that best corrects the blurred vision. Sometimes, an automated refraction is used, which involves an autorefractor. This machine shines light into the eye and measures how it bounces back, giving an objective estimate of refractive errors, including astigmatism. However, this method might be less accurate if the eye has certain conditions like cataracts or very high refractive errors. Next, keratometry is a common technique that measures the curvature of the cornea. The device reflects light off the surface of the eye, and differences in the steepness or flatness of the cornea reveal the presence of astigmatism. Since astigmatism results from an uneven corneal shape, keratometry provides quick, painless, and numerical data indicating how severe the condition is and in which direction or axis it lies. For more detailed analysis, corneal topography is used. This advanced imaging creates a three-dimensional map of the entire surface of the cornea. It detects subtle irregularities that might not be visible with other tests, making it especially useful for complex cases or for fitting contact lenses. It can also help diagnose conditions like keratoconus, which can cause irregular astigmatism. Another simple but effective test involves looking at a pattern of radial lines, similar to spokes on a wheel. The patient reports if some lines appear clearer or darker than others. If some lines seem distorted or blurry, it can suggest astigmatism and help determine its axis. Along with these tests, visual acuity assessments are performed using standard eye charts. If vision is consistently blurred or distorted at various distances, it can be a sign of astigmatism, prompting further testing. Finally, after all these evaluations, the optometrist will analyze the prescription. This includes the sphere value for nearsightedness or farsightedness, the cylinder value which indicates the degree of astigmatism, and the axis, which shows the orientation of the irregularity. Combining these measurements allows for accurate correction with glasses, contact lenses, or other options. All these methods work together during a comprehensive exam to ensure precise detection of astigmatism. Early diagnosis is important because it helps maintain clear vision and eye comfort. Detecting and correcting astigmatism also supports overall eye health, which is especially important in managing other conditions like glaucoma or macular degeneration. These techniques are standard practice worldwide and are backed by scientific research and clinical guidelines, ensuring that patients receive safe and effective care. If you suspect you have astigmatism or notice vision changes, it's always best to consult an eye care professional for a thorough evaluation.